In the last 3 decades, the role of audit has become increasingly important as a mechanism for driving quality improvement in healthcare systems, and it is now regarded as an essential skill for all aspiring surgeons. The best audits are well-planned, large patient numbers, and a clear prospective plan for data collection, with the aim of clinical change. Big multi-centre audits, such as the Scottish Audit of Surgical Mortality and National CPOD, have driven significant improvements in the availability of resources within the UK healthcare system and ensured that basic standards are met across all hospitals. While these large multi-centre audits are essential in modern surgical practice, for the aspiring surgeon there is a need to demonstrate the ability to consider, design and implement audit whilst completing the audit cycle, and preferably going on to present it at an appropriate level in order to get the maximum marks in that all-important core or specialist training interview. Kenneth Mackenzie is a urology trainee who has shown outstanding ability in designing audits and has very kindly agreed to talk to us through his approach to audit at the FY to CT2 level.
This presentation should take roughly 20 minutes and I'm going to break it into 2 key parts. The first will be to talk through the audit process itself, and then the second will be trying to maximise the opportunities once you've completed your audit. So, as has been said in the introduction, clinical audit is an essential requirement that is undertaken in all departments and also on a regular basis. It's expected at all levels of specialty training that you have undertaken an audit, and you can get a variable amount of points depending on how much of an audit you've completed. The maximum points that you get is for at least 1 closed loop audit, so you should really be thinking about completing a closed loop audit by the time that you come to core applications. It's also a good opportunity to show commitment to a specialty. This can show that you're willing to undergo training within that specialty, and also it can get you points when it comes to core training for showing commitment to specialty. The 3 areas to get maximal points will be to devise the audit, design the audit, and then present the audit. And if you can lead in all 3 of these areas, then that should get you maximal points. As will be highlighted at multiple times during this presentation, getting points for applications is the most important thing. So the audit cycle comprises of 6 aspects. The initial part will be to identify a potential audit, then establish the standards of practice, followed on by the data collection, then comparing your data to the standards, and then trying to implement change. Once you've implemented that change, you progress on to re-auditing your change to see if any difference has been made. And what we'll do is we'll talk through each of these sections during this talk. So identification. This, you can decide to try and change or assess one of 3 or all of 3 aspects. This can be looking at the structure of care. So this may be looking at the resources available within a department. The second is the process of care. So a common one is looking at the time lost between theatre cases. And then the third is outcome of care. Again, this is very commonly performed, and this may be looking at measuring the response to an intervention. So in the identification process, this is really the key and the crux of your performing a good audit. What you should do is identify or choose a supervisor within a department who is known to complete audits and projects. This is really important because they can be so helpful in providing proper supervision, and also they can give you something that may be relevant and up to date. When you're in a department, you should probably ask the trainees, as they generally have a good handle on who in the department is good at completing the audit process. The second is, what I've found is that if you present a supervisor with an idea, so if you go with the basis of your audit set out, then they will, one, be impressed by this, but also they may modify your plan or give you a new, better audit project. The most important thing is, when you're trying to identify something, is you want to make it achievable. If you're a medical student, you're generally on a rotation for 4 to 6 weeks, or as a foundation or CT trainee, you're on a rotation for 4 months to 6 months. So it's really important to try and identify something before you start your rotation, Try and get the basis of your audit set up before you start, because when you're there, you want to perform the main things, which are data collection and then implementation. I've found during my experience that implementation when you're in a department is significantly easier than trying to go back many months down the line. Also, when you're thinking about what you're going to audit, then you should also be thinking about your change. You should be choosing a project that has a straightforward implementable change, and this should be highlighted at the beginning. When you go to speak with your supervisor, then you must identify the established standard for your audit. So an audit is comparing against a standard. What you should do is choose something of interest, identify the gold standard within that topic that you're going to audit, and then present that to the consultant. There's a number of audits that are nationally done and commonly done within your department, such as VTE, antibiotic usage, theatre efficiency, as mentioned. These are good and important to the trust. However, when you come to presenting, they may not be quite as desirable as, say, a novel project. So thinking about a novel project is really important. Additionally, for a standard, looking at the NICE or SIGN guidelines may initially make your life easier, and also may provide, if there has been a recent change in either of these guidelines, then this can provide a very nice, easy, straightforward audit. Data collection. So with data collection, this is going to be the part that's going to be most time consuming for you and potentially the most difficult for you. There's 4 key things that you should think about before starting your data collection. The first is to decide whether or not it's going to be a prospective or retrospective audit. For prospective, it's more challenging, normally more labour intensive, as you're going to have to collect data on a continual basis, which may take a couple of months to do. A retrospective audit is generally more straightforward. You have your cohort fixed and you can generally do a case note review on these patients, so it's generally, as I said, more straightforward. Sometimes it's easier to do your first part of your audit retrospectively, and then do your re-audit prospectively. The second important aspect is team members. You should always establish the roles within the team prior to starting the audit. If you're organising the audit, you should become the lead person in the audit, and also plan who else you may need. Generally, what I would say is that you should aim to get your data collected within 2 to 3 months. If at 2 or 3 months you're just struggling to get all of the data that you need, then it's not a bad thing, and it's not a failure if you ask someone else to come and help you. Again, define their role, so they will be defined as data collection. They won't be the first author. You're in charge, and you can command that as the lead of the audit. But getting someone to help you is generally quite easy, because people like to put in their CVs being involved in an audit that's already set up. The third point is deciding how you're going to obtain your data. Identify the source for this. It can be potentially case notes or electronic records. For case notes, what I've always identified is that case notes take a very long time. Generally, you're not in control of obtaining case notes. This can be left to the audit department, which can take a variable amount of time, and also notes aren't always available. They disappear and can make life very difficult. Electronic records are generally much more straightforward and an easier and potentially quicker way of assessing or obtaining information. Fourth is that you should establish the method of how you're going to correlate and collect your data. So lots of people use Excel spreadsheets, or you may use hard copy and written pro formas. With either of these 2 things, you must think about confidentiality. I can't stress that enough, that for an Excel document, you should always have it password protected. And same with written notes, you'd have it in a locked filing cabinet or in a locked department. The thing that I've found when performing audits is when creating an Excel spreadsheet, I should have gone to my supervisor at the beginning to look through the columns that I'm going to get for the data that I'm going to obtain. What I've found on a number of occasions is that a consultant comes back and says, "Oh, well, you should have looked at that as well." And then you have to go through your whole cohort again. If you're able to get your spreadsheet absolutely perfect at the beginning, then your life just becomes a lot more straightforward. Other important thing with data collection is that all audits should be registered within your local audit department. Generally, there's a Caldecott guardian as well, who will have to be addressed so they're aware that you're safely storing your data. So comparing the standards, there's an intimidating word of a literature review. If your standard is taken from a NICE or SIGN guideline, generally a literature review has already taken place, and this can make your life significantly easier. If it is not from one of these guidelines, then it's always worthwhile to ask one of your seniors if they can potentially help you with this or give you guidance. It's too much information to go into how to perform a literature review during this presentation, but it's something that you should develop as a skill over the next few years. And then finally, when you're comparing to your standards, you've got to analyse the data that you have obtained and then compare the results to the standards itself. In an audit, you're going to get a large amount of data. Some of that data isn't relevant when you're comparing it to the standards. This should be remembered. Sometimes less is more, and that should always be remembered when trying to put forward your point. Number 5 is implementing a change. When you have your data and you've compared it to the standard, you should look and try and identify something that you want to implement to try and improve that process. With regards to that, you should discuss this change with your supervisor to create something that is achievable. And I mentioned this at the beginning. It should be, from my experience, I've tried to implement changes at a departmental level and also within a trust level. Departmental is relatively straightforward. Everyone generally supports your idea and can be done fairly quickly. If you're trying to implement something on a trust level, this can be exceptionally more difficult. It can take a number of months and require a large amount of paperwork and a number of board meetings for it to get accepted. Sometimes it's very worthwhile, but just remember when you're preparing this that it may take much longer than what you expect. Once you've got an idea for implementing a change and your data is collected, then this is an opportunity, the first opportunity that you can have to try and present your data. And I will discuss this later on in the talk about the methods that you can use to present this data. And then number 6, the re-audit, the difficult one. This shouldn't be difficult, because what you should do is you should already be aiming to complete your re-audit shortly after you leave a department or while you're still in a department. Whenever you're planning, you should aim for the whole process to take less than 12 months. If I'm in a department and I'm not going to be able to re-audit in time, what I always try and do is identify another trainee that's coming into the department, ask them if they want to be involved. If they do, then put the onus on them and inform your supervisor that this will be the person that's completing the re-audit. Another method for re-auditing is, rather than creating your whole own audit yourself, there will be a number of audits within the department that have already gone through the first 5 stages and the implementation has never been reassessed. If you discuss with your supervisor or potentially the trust audit team, they can identify the audits which have not had what's known as the closed loop. This can be a very quick way of completing the whole audit cycle, and sometimes you can get the same points in interviews if appropriate. So in summary of the 6 stages of the audit, generally when you're deciding an audit, you should choose an interesting topic, potentially within the specialty that you want to go into in the future, but this is not key. Importantly, what I found is that if you pick something that's interesting or that you're interested in, then you're much more likely to complete it. Think about the way that you're going to collect the data. Maximise the use of IT systems if you can. Time, as I've mentioned, is the key. You want to make sure that you've got achievable goals within the time that you're in a department, or completing it as soon after you leave a department. And as I mentioned, you should always be using 12 months as a kind of gold standard for completing your re-audit. Also, preparing and planning well can also look very impressive to supervisors. It can look good for a number of reasons. You can show commitment and organisation to a supervisor within that specialty, which looks good on your CV, but also supervisors want someone that's keen and committed. And if you can show this, then it's likely that they will take on or ask you to undertake further projects or potentially publications within their department in the future. So that's something that I've definitely found since undertaking a number of audits. The next is maximising your opportunities once you've completed your audit. You have a potentially quite large amount of data that can be interesting to a number of people, and you need to present this. This can be presented locally, regionally, or nationally. Within your local department, there generally should be a monthly morbidity or mortality meeting, or departmental meetings. I would say that your data your audit should be presented at local level at a bare minimum. Regionally, there is normally subspecialty regional meetings that happen on a regular basis, and you should always try to present these as well, as they're interested in how local departments are performing. And then finally, the national presentations. There is a lot out there for medical students and foundation and core trainees that should be maximised when completing the audits, and I'll talk about these next. So as you can see, there's a number of annual surgical conferences, 3 of which I've noted are organised by the Edinburgh College. The Student Research Symposium and the National Aspiring Surgeons Conference are both for senior medical students and foundation doctors, and are very, very good opportunities to try and present your audit data. Additionally, there's the Audit Symposium, although this is open to all trainees, so may be more difficult to get into. The ASSET, which is the Association of Surgeons in Training meeting, and also the Atrium, which is the Edinburgh Surgical Society National Conference, are good ways to present nationally. If you look at the timeline, generally suggests that abstracts are in between November to January. So what I would always do is, in your 12-month cycle, when you're preparing, you should always be focusing on finishing your audit by October. This will mean that you'll have an abstract ready for when all the abstract openings occur, and then you'll be ready to present in the new year with your fully completed audit cycle. So once you've been submitted or writing an abstract, as silly as it sounds, reading the guidance is so important. There's a lot of subtle changes within each submission. What I always check are 3 things. What subtitles do they want? What font and what size of font? These basic changes can make all the difference and stop your abstract from being rejected at the first stage. When you're writing an abstract, you've got to think about the person that's marking your abstract. They're going to have lots and lots of abstracts to read. You need to make yours interesting. You need to make it punchy and have a question early on. You either have it early in the introduction or potentially even put it into your title. As an example, just think which is better out of these 2. The first title is a review of the effects of the new consultant-led urology service in St Elsewhere on emergency care. B is are consultants better than juniors at managing urology emergencies? Instantly, to me, B is much punchier. It engages the reader, and you're already on the front foot when the reader goes in to read your data. Also, the structure is also very important. Think, as I said, look at the general guide as how it should be set out. Most are broken into 4 areas. So within the introduction, you may require a reference, or you may need to put in your gold standard from your national guideline or international guideline. But you should also include your aim generally within your introduction. This is where I always put my aim in the last sentence, so that it helps with the flow of the abstract following this, so the reader is aware of what you're wanting, the message that you want to get across. With regards to the methods, keep it clear and concise. You always should state the cohort, so put it as an N number. You must discuss the period of time that has been undertaken, and it can be useful to say whether or not it's a retrospective or prospective audit. You sometimes can get more points for doing a prospective audit. The results section, this kind of builds upon what I mentioned earlier about highlighting just the key results. People are not interested in every result that you have. You should probably ask for some feedback from your supervisor as to what is the key results that you've obtained, and make your sentences short and punchy so that the message is conveyed well. In the discussion, you must always say whether or not you've managed to achieve your aim and how it compares to your gold standard in your audit. With regards to a recommendation, which you should always put within your discussion, I would suggest that you only ever put one recommendation, because if you try to come forward with multiple recommendations, this is realistically quite unachievable. And finally, you should always ask your supervisor to check. You may think that an abstract that you're going to submit to a student-based national conference isn't worthwhile, but it is. They're interested in what you have written, and also it is their own work. The supervisors are generally very well experienced in writing abstracts and can help you significantly in trying to make your abstract more interesting and clearer. Two things that I would always make sure is, one, make sure you spell check it. It is very simple to say that, but something that can easily be missed. And then second, read your abstract aloud. You need to think about flow of an abstract. It should progress from your introduction to methods, results, discussion seamlessly. It should be like a short story with a clear message at the end. So now we're going to talk a bit about presenting. You've had your audit accepted, which is excellent, and you're going to take it forward and you've been asked to present a poster presentation. For the first time, this is quite a daunting thing. Where do you start? How do you find out what to do? There's generally quite a lot of advice online of how to create a poster. What you need to, a useful thing to do is develop it through Microsoft PowerPoint. Generally, you can create one slide, and then that can be developed into your poster. Again, follow the guidance. It seems simple, but you can be distracted by other things, and you sometimes may just make it look very, very poor. Think about the size of the text as well. You're going to delegates and assessors are going to be reading this. Generally, they have a couple of minutes to read the text, so you don't want your text too small. You don't want to be putting in a whole paper onto a poster. You want to keep it short and keep your message clear. You also want to make your text readable so that you can read it generally from 4 feet away so that they can see it nice and easily. As I've mentioned, trying to keep it concise is really important. Diagrams and graphs are generally very useful at conveying quite a lot of information quite quickly. The only thing I would say is that your diagrams must add something to the message that you're trying to convey. Having a random bar chart of breaking up your cohort may not be very useful. Labeling all diagrams are also very important, and you may require 1 or 2 references, but as I said, you're not trying to put a whole paper into a poster. It's a short, punchy text, and it should only have 1 or 2 references. It doesn't require 15. An oral presentation. This is very useful when it comes to scoring points in your application process. Generally, oral presentations are asked to be given over 4 or 6 minutes, and you'll have 2 minutes for questions. You should always remember to think about the questions and what you may be asked so that you're able to provide good answers to these. When given an oral presentation, I generally think about keeping the slides as simple as possible. Too many words can be very distracting. you're giving an oral presentation. You want people to be listening to what you're saying, not reading your slides. And that's really important. Hopefully through this audit presentation, you'll see that I've tried to keep my slides fairly short so that you can listen to what I've been saying. And the same goes to presenting on a stage. Again, I've mentioned flow. Your slides should fit together. They should go in a natural stepwise progression with your aim and your message always being conveyed in each slide. And then the final one is that you must practice, practice and practice. You cannot practice too much for when you're coming to an oral presentation. Something that I've done is recorded myself using my phone or a dictaphone to hear how my tone, the volume of my speech, the intonation that I have, it's amazing how much I've learned from just listening to myself. Also, again with your supervisor, you should always ask them to have a practice presentation with them. They'll be able to help you so much and just guide you and just give you little snippets of information that can help you just sound much clearer and much better. The other thing that I would say is that you're about to give a presentation that's 4 to 6 minutes long. This is not a long period of time. I would say if you practice enough, you shouldn't need to read your slides at any point and you shouldn't need to use any cue cards. I'd say both of these are very distracting and it can make you look quite clumsy. So if you want to look slick and look really good, make sure you practice and you've memorized your whole PowerPoint presentation. So in summary, as has been mentioned, audits are fantastic opportunities. You can develop connections through them, and they can show an early commitment to specialty. You should be creative. As I said, novel ideas are priceless. If you're marking something for presentations, you see the same stuff come up over and over again. Try and make it really creative and different. Make sure it's achievable. You don't get any points for starting an audit, collecting half the data. You must always aim to achieve at least the first 5 steps of the audit and present it at a bare minimum at a local level. And also the thing that I would say from my experience is don't be afraid to say no. During your career from a medical student to me being now a core trainee, I've been offered a variety of projects. Some of them sound very promising and some of them sound very labour intensive. Whenever you take on a project, you must think to yourself, do I have the time to do this? Am I interested enough to do this? And can I complete this? If you can say yes to all 3, then you should do it. You should also make sure that whatever you're taking on, it can be presented and it's not recently been done by someone else. These are all just things that can make it more interesting. So thank you very much for listening. That is the end of my presentation.